Hello, and welcome to this animated introduction to ankle joint function in haemophilia. We will look inside a healthy ankle, illustrate what actually happens during a bleed in the ankle, show you the complications that can arise, and consider how to manage ankle bleeds and optimize joint function. Let's look first into a healthy ankle joint. There are four main bones in the ankle. The bones of the lower leg, the tibia and the fibula, connect above the ankle bone called the talus. The tibia is the main bone of the lower leg. The fibula is the small thin bone along the outer edge of the tibia. The talus rests on the heel bone called the calcaneus. The ankle joint is where the tibia, fibula and talus meet. This is also known as the tibio-talar joint and is the main ankle joint affected in haemophilia. Another joint connects the talus to the calcaneus. This so-called subtalar joint can also be affected. These two joints allow the foot to move in two main directions. The tibio-talar joint enables up and down movement, called dorsiflexion and plantar flexion. The subtalar joint enables side-to-side movement, called inversion and eversion. The ankle and foot play a number of roles during normal movement. These include absorbing the vertical and horizontal forces generated in the leg during motion, adapting to changes in the ground surface, providing a rigid lever for pushing against the ground. These movements put different stresses and strains on the relatively small ankle joint surface, making it especially vulnerable to damage in haemophilia. Indeed, some recent evidence suggests that ankle bleeds are the most common type of bleed in some groups of people with haemophilia. Now, let's look at what happens inside the ankle during an acute bleed. Like other joints, the ends of the bones in the ankle are wrapped in cartilage that protects them from the impact and friction of movement in the joint. The joint is surrounded by the synovial membrane, or synovium. The synovium produces a lubricating fluid, synovial fluid, which allows the bones of the joint to move smoothly and helps to keep the joint healthy and functioning. When a bleed starts, blood leaks into the joint space and mixes with the synovial fluid. World Federation of Haemophilia guidelines recommend that the bleed should be treated quickly with clotting factor, ideally within 2 hours. The synovium becomes inflamed as blood accumulates in the joint space and the joint begins to swell. As the blood accumulates, the body attempts to break it down into waste products and iron to remove them from the joint space. If this were the only bleed, the synovium would be able to reabsorb the blood over time and the joint would heal. With recurrent bleeding, the synovium progresses from acute to chronic inflammation, which is known as synovitis. The synovium thickens and grows tiny, finger-like projections called microvilli. These are prone to being pinched between moving joint surfaces, leading to further bleeding. The hypertrophied synovium also causes pain and impairs the movement of the joint. Further damage can also affect the cartilage and bones in the joint. Bony spikes, called osteophytes, can form at the anterior part of the bone and are a particular and common characteristic of ankle arthropathy in haemophilia. The bone grows abnormally in response to the degenerative damage within the joint, which includes inflammation, increased pressure, and minute traumas to the cartilage and bone at the joint surface. Osteophytes can impair joint movement and also pinch the synovium, leading to further bleeding and pain. Over time, this joint damage, called haemophilic arthropathy, can cause changes in the shape of the joint, further impairing function, walking, balance and posture. A small amount of ankle swelling after an acute bleed can impair proprioception, which is the sense of movement and position of the body. In early stages of arthropathy, up and down motion is only slightly affected. But in later stages, the ankle and foot can become rigid and immobile. Changes in the function of the ankle can also affect other joints, including those in the foot and knee. As we have seen, repeated bleeds into the same joint cause a vicious cycle of damage, with more bleeding in the short term and more structural damage in the longer term. However, there are simple things that can be done to actively look after the health of joints. By recognizing the early signs associated with an acute joint bleed, action can be taken to stop it. Pain, warmth in or around joints, swelling and stiffness are all signs to be aware of. Check joints regularly for any changes in how they move or feel. If you feel something, do something. When a bleed is detected, it is important to treat with clotting factors as soon as possible. Early treatment means less blood in joints and fewer complications over both the short and long term. Besides treatment with factors, other options that can be taken to treat an ankle joint bleed include protecting the injured ankle from undue stress. It is important to avoid weight-bearing activities. Using a crutch for 3 to 4 days can help to keep weight off the affected ankle. Resting the ankle for at least 24 to 48 hours and keeping it elevated. Applying ice for 15 to 20 minutes every 2 hours to help reduce the pain if recommended by a healthcare professional. Compressing the joint using a bandage or compression stocking for the first 24 to 48 hours. Specialist physiotherapists can help address ankle issues by identifying the particular problem, suggesting appropriate exercises to build strength, balance and mobility, selecting the right footwear and orthopedic insoles, also known as orthotics. Surgery can be helpful in some cases, for example to remove osteophytes, reduce pain and increase range of motion. Lifestyle choices, such as regular exercise, maintaining a healthy weight, and being more aware of what activities help or harm joints are all part of protecting joints from damage. Doctors, haemophilia specialist nurses and physiotherapists have lots of different ways to help people with haemophilia optimize their joint function for longer. It's important to react quickly to ankle problems. If you feel something, do something. This concludes the presentation. If you have any other questions, please talk to your doctor or haemophilia team.